3, 2, 1, live.
What's up, guys? John here, Titan Talk Tuesday. About to get it in. Getting better and better out there, man. I'm telling you. I'm glad this week, every day it seems like things are getting a little bit better out there as far as where I'm at in the country here in Tampa. Thanks for you guys all joining me. It's going to be a great show today. Plus, we're going to do a giveaway today for Stimulus Package 3, the Titan Corona Stimulus Package giveaway. And what will that giveaway entail? So the free giveaway that I'm going to do today is going to entail a free medical provider visit, and it's going to do a free immune system boosting therapy package. So if you're not a patient at Titan Medical Center, you'll get a free medical visit and you'll get a free therapy. What's up, guys? How y'all doing? Thank you for joining me. What's going on? How you doing, Paul, Kenny, Jackie, everybody joining in? Daddy Shock, thank you. So if you are a patient, you can still win. You might need the medical visit, so that'll be free. If not, you'll still get the free therapy. So everybody wins at that point. So the giveaway will be after that. I'll give you guys the instructions of the giveaway so you guys can possibly win the free medical provider visit with the free immune system boosting therapy package just for you guys, all right? And today we got a great show, like I said. It's getting better and better out there, so I'm getting happier. People seem like they're getting, they want to get out, so that's a good thing. I want to make sure everybody's safe out there. Getting kind of crazy. So let's get into it. How you doing, Amanda? What's going on? Lindsay, how you doing? So let's get into the therapy of the week. Let's start with that. So the therapy of the week this week, and every week we change them. This one is our ECA Stack Plus. Because, let's face it, Memorial Day is what, next weekend? Summer's right around the corner. We are going to be out and about. It looks like our country is going to be back open pretty much everywhere, I think. So what does that mean for us? That means that, hey, listen, we're probably going to have to get a bathing suit or some shorts or a shirt or something out there, right? Because it's going to be hot. 1, 2, you might be going by the pool or out to the beach or on vacation. You never know. So, ECA Stack Plus, let's talk about it. What's in ECA Stack Plus? What's it combined of, right? So ephedrine, caffeine, aspirin, B12, and chromium are the main components and active ingredients of our ECA Stack Plus. Different dosages for different people. So some people are more sensitive because there are some stimulants in this. And let's talk about the ingredients. The first ingredient is ephedrine. Ephedrine is a stimulant. It's great for burning fat, right? It's great for giving you energy as far as concentration wise too. Now the next one, ECA. So the next one is caffeine. Caffeine is also a stimulant. It's going to help with energy. These things together will help boost metabolism and help burn fat faster. So they're really good for energy, concentration, and burning fat. Now you have aspirin. Which aspirin, with the blood flow, it helps with no palpitations. So with this therapy, it should give you all the great benefits with no nausea, no heart palpitations, no jitter-like functions of it. So it should be really clean and smooth energy. Now, the best things that we added on top of this, because ECAs have been around for a long time, but the added components as far as B12 and chromium are the real kicker for it. It's just like another cherry on top of the sundae where it's going to help naturally get the metabolism moving, naturally help you burn fat faster through the body, along with B12 helping with energy levels and actually helping in a lot of different ways. So nervous system, red blood cell count. So a lot of different things go along with this therapy. This therapy is an oral therapy. A lot of our therapies are injectable. Now, hey, what's going on? How you doing, man? So at that point, this one's oral, so everybody can take it. A lot of people, they don't mind the injectables. Some people do. So this is always a good go-to for a weight loss therapy for somebody that does not like injections. Now, if you do like injections, that's fine too, because this goes along with every other therapy that we do, whether it's Hercules Potion, Titan Complete. If you go on an HCG weight loss program, this is a good one, because on those, you want to stay in a calorie deficit. Not the 500 calorie diet that was originally done for HCG. I think that's not a good plan as far as calorie count for somebody. Of course, when you only eat 500 calories, you're probably going to lose some weight, right? But the whole point is to be able to lose this weight, maintain the lean mass that you have, and feel good while you're doing it. So you don't want to feel all tired down in the dumps because you have no fuel in the tank, right? Your body's in a calorie deficit. You might be carb cycling or carb depleting, and at that point you just have no energy or no get up and go. Where this is going to put some gas in the tank. That's going to help out, especially if you want to substitute coffee or energy drinks or pre-workouts, especially pre-workouts out there, guys. It has a number of different components out there that are not probably good for you. A lot of fillers, and they don't make you feel good. So when you take a therapy, you should feel good. You shouldn't have to feel like, oh, I might have to go to the bathroom, or I feel nauseous after I take this, or I feel like I'm bouncing off the walls. I can't get control. You shouldn't feel like that. You should be in control of what's going on. And this therapy should be working for you. Now, the best thing is this is prescribed. So this is coming from a licensed U.S. pharmacy. It's being prescribed by doctors and medical providers. You can't get this over the counter. You can't get this in a supplement like that from GNC or a big box vitamin and supplement company or whatever it may be. So legally, this is the only way you can do it. Now, the best thing about it is, yes, you can pass a drug test on it too as well. You shouldn't have any issues with that. Especially, you can even tell them, hey, listen, I have a prescription for ephedrine. And at that point, if you're honest with the people, you have a prescription to back it up. That's the best thing about Titan Medical Center. We can help you guys out with all the different therapies that we do, and it's all the right way. As far as you're getting medically prescribed these things, medically monitored by these things. They're coming from U.S. licensed pharmacies, so you guys should feel warm and fuzzy as far as that goes. Everything's tested, so you guys are getting quality therapies, quality monitoring, quality staff. And if we're letting you guys down in any way, shape, or form, I want to know about it because I'd like to get involved with that if there is. But usually I hear a lot of great things. So unless there is a problem, I usually don't get involved. But if there ever is, I want to make sure that we nip that problem in the butt. So ECA Stack Plus, great, especially with the summer packages going on. There's discounts on the summer packages. Like I said, you can use this with Tighten Up, with Titan Complete, Hercules Potion, any of our therapies that we have. Even if you're just on hormone replacement therapy and you want to lose some weight, lean up, you have water retention or there are problems, issues as far as that goes, you have no energy, this is a great therapy. So this is the oral therapy, and you can mix it with the Titan Fat Burning Cream, which is the topical. So that a lot of girls do that, especially right now. So if you guys are looking for energy, you guys are looking for weight loss or fat burning, you guys are looking for better concentration, ECA Stack Plus is going to be your best bet. Been around forever, one of our top therapies. Can't recommend it enough. I take one personally in the morning, and like I said, there's different doses for different people because some people are very sensitive to stimulants, whether it be pre-workouts or coffee or energy drinks or stuff like that. I get people all the time that say, hey, John, because when we say, we have our prescribed fat burners. Oh, no, I don't want to do that. I took some fat burners over the counter, and man, they made me feel bad, or I had heart palpitations or arrhythmias and stuff like that. I just didn't like that feeling. This is not like that, okay? You're going to get a good euphoric feeling. You shouldn't have a negative feeling from this. So just remember that, okay? This is not an over-the-counter supplement. This is prescribed, coming from a U.S. licensed pharmacy, prescribed for you guys. What about eating clean? Can you diet or when you eat impact the effectiveness? So obviously, yeah. So this is a great question. So with this, you always want a good diet. And I've been getting away from the word diet. Drew's been hammering down on me. The way that you eat. So the way that you eat, you want to eat clean. You want to eat good, clean food, good calories. So when you do this, you're going to get way better effectiveness. Now, diet, okay, I hate using that word, but it is a diet and an exercise program. So your meals and your nutrition program obviously are going to increase the effectiveness of any therapy. That should be your foundation. A lot of people come to us and they don't have that foundation. And some people need the motivation because either the testosterone levels are real low and that could cause lack of motivation and not feeling right and not want to be able to get there or be able to do anything or want to do anything, or you just lose interest because of that. So some people need that. to start it. But once they get into the rhythm, then the nutrition factor comes in. They like working out. They start seeing some results because that's what we want, right? We're working out. We want to see some sort of results. We're doing these exercises. We're eating these meals that maybe we don't want to eat, but what are you getting out of it? Are you getting the results? And that's where it really comes into play, where we want to get those results. And the thing about the Titan therapies is that should expedite those results, right? We give you those tools, but you guys need to utilize those tools. We can help you guys as long as, setting you guys up with a great regimen, telling you guys what to do. But if you guys don't do it, it's not going to help. So you guys got to remember that, right? There's our responsibility to you, but you have a responsibility to yourself. And that's really where it comes into play because, we're not there to monitor you 24/7. Trust me, if I could do it, I'd do it for you guys. I'd monitor every single one of you guys and help you guys out. Because sometimes people need that push. They need that, micromanagement to a degree, just until they get in a routine. And then once they get in that routine, they're good to go. It's like teaching, teaching anybody, whether it be an animal or a kid or a person. It's repetitiveness, right? And consistency with whatever you're doing. So how about saying eating regimen or lifestyle change instead of diet? That's what I always say. Just saying, you're right. It's a lifestyle change. You're absolutely right. And their eating regimen. That's why I said by their meals. Absolutely. Good one, Josh. I know it's off topic, but have you ever had shoulder impingement? If so, how do you work around it? Any suggestions? All right, so yes, I've had shoulder impingement. I've got a slap tear in my right shoulder right now. So at that point, I'm not happy, and I was in a lot of pain laying down. Now, impingement from shoulders, there's some things that can happen that can help you out. Now, first off, if you don't know if it's torn or not, you might want to get an MRI just to check. If you think it's just an impingement, for sure, you're probably getting plagued by inflammation. You're getting clickiness and, maybe not being able to, use the arm above the head or, not utilizing it at all at that point. Some people, they have stiff shoulders and they can't get out of that. So the best thing to do is probably look at a doctor in your area and look for a cortisone shot. Now, cortisone shots are awesome. You can only take so many a year, and it's really covering the bleeding wound with a Band-Aid. I'm just gonna be honest with you guys, but it can help tremendously. It's helped me tremendously. I couldn't do this without feeling a lot of pain and not doing it. So the cortisone shots are good. They'll bring down the inflammation, so hopefully the blood can get to it and heal the area. BPC 157 may be able to heal it after that, but taking the inflammation out is the first thing you want to do, and icing and stuff like that afterwards. But that may be something you want to try by maybe an orthopedic in your area or a good doctor that, can give those joint injections. All right, Kenny? So that let me know if it does help, though. So cortisone shots are really, really good.
Got a couple comments up here.
Shark. All right, Shark. My man Neil Burner, dude. I love you no matter what. I love you, man. Let me see what else. Let me see. All right, is it good for men and women? So so men and women can both take ECA Stack Plus. So all the therapies that we prescribe, usually men and women can both take them. And we cater to both men and women. And we do nationwide service. So wherever you're at in the United States, we can service you. And we can service you very simple and very easy. You could be on your couch right now and do an appointment with one of our medical providers via your cell phone, your tablet, your laptop, your desktop. Whatever you want or whatever you have there, we can do a consultation, a video consultation with you guys. And at that point, you guys can order your vitamins, amino acids, all that, and they get shipped directly from the pharmacy to your doorstep. So you don't have to go out. If there's stay-at-home orders and you're worried about that, they'll get shipped right to the door. If you're sick, immunocompromised, or by somebody that's immunocompromised or high risk and you're worried about getting them sick, don't worry, because it's going to come right to your doorstep. If you guys want hormone testing or you guys want to go on testosterone replacement or HRT therapies, it's real simple and easy to do for you guys too. We can send you into a lab, a blood lab in your area or zip code. They're all open around the United States. You guys can get your labs drawn. We take care of everything. We get the results. And then after that, we schedule with the medical provider for your consultation. And I'm going to go over some lab results of my own today. So stay tuned for that. And I'll kind of explain what these tests for. What is in layman terms? What does this test really mean for me, John, right? Because they all mean something. whether it be a little detail or a bigger detail. And all of them, honestly, all those little details add up to a big result. So we want to really know what we're getting tested for. And this information you can utilize with us, or if you go to your primary care physician or other primary doctor or whatever's running blood tests on you, you guys will be educated. And that's really where it's at. Knowledge is power, and the education is key. And once you have that education, you'll be more in tune to what's going on and what these medical providers, if you're not using Titan Medical Center, even if you are, how to utilize it or what's really going on and how you guys can help yourself. So we'll go over that too. So men and women can both use it, all right? What if you want to do hormone therapy? Can you do weight loss? Yes, absolutely, Erica. So even if you want to do weight loss, now hormone replacement therapy really does help with weight loss. It helps with metabolism. It helps with sugar levels, cardiovascular issues. So you have a lot of different benefits you're going to get from hormone replacement therapy, especially if your hormones are off. If they're deficient or low, or they're off, like as far as, estrogen's real high, testosterone's real low. There's different things that could be holding your results back or the way that you feel. Let's not even talk about physical. Let's talk about mental, right? And mental health is declining in the U.S. because of what's going on out there. A lot of people have been trapped in their houses and stuff like that. There's a lot of mental decline. Suicide rates have went up. I know, some people that we know just had suicide. So these are serious things, and people aren't in good places. And this could be because of hormones to a degree, right? And there's a correlation between having low testosterone with being depressed. And we've seen that through blood work, and usually, most of the time, if you do correct the problem at the root of the problem, you'll fix it going forward. And these people have awesome results afterwards. So, yes, good question. Way to do it. What's up, Dave? How you doing? That's the way science works. That's right. You work with it. That's fine. My man, dude. Lifestyle worth living. So, David's he's a great example of what it is, man. Dude's got energy like a 5-year-old running around still. BPC, will work bone on bone for knee. Mark Buccetti. All right, TB500. All right, so soft tissue is usually a TB500 thing. Bone on bone, Mark, I can't promise you the world on that. It could help with inflammation and stuff like that, blood flow to the area, so you might get some relief. It might be a little bit better, but I can't promise you that it's going to heal something like that, okay? I want to be very honest and very transparent with you guys. We got some great therapies that do a lot of great things, but some things, it's not a miracle on some things. I wish it was, because it would be awesome. Now, PRP, that might help. I've heard a lot of people doing PRP, and we're going to start PRP here. So if you guys are in the area and stuff like that, we do IVs, PRP, primary care, all this stuff. We also do primary care nationwide. So if you're looking for somebody to take care of your primary care needs, Titan Medical Center can have you, or help you. Excuse me. I've had 2 labs done the last 6 months. Will you require a new lab? My levels were in the 180s. No. So if you have all the lab tests that we need, and they're within 90 days, I know they say 60, it's usually 60 to 90 days, then no, you're not going to have a problem with that. And 180 is very low, especially if it came from LabCorp or Quest. Now, there's different reference ranges, so I got to make sure we're talking about the right lab before we say that's low. But if that was on a LabCorp or a Quest reference range as far as testosterone levels, you're clinically deficient. At that point, you're probably going to need some help in hormone replacement therapy. And then, at that point, the shades should open up. The sun should be shining through, and it should be like a new day and age for you guys. That's exactly how I felt over 10 years ago when I found out I had low testosterone, and I went on my treatment and therapy program, and it was like a game changer, man. And honestly, I could say that it's helped every part of my life, right? John, what about AOD and ECAs? Good combo. Thanks. So AOD, Advanced Obesity Drug 9604. That was the therapy of the week last week. And that's fragment chain of HGH, basically taking all the good parts of that sequence and getting rid of the negative parts. So it's a really good one. ECA Stack Plus is good with any therapy we do. I can really say that. Now there's some things that might disqualify you from getting ECA Stack Plus, but it might be cardiovascular issues, if you've had heart attacks. There's certain health issues, that we want to make sure. But majority of our patients can take them, or healthy enough to take them. And at that point, like I said, for me, game changer. I take one every morning, and it gets me through my whole day. No coffee, no energy drinks. I don't drink them. I don't drink pop. I don't take any extra caffeine. I don't take pre-workouts. I don't do any of that. And anybody that knows me or is around me all the time can vouch for that. They'll never see that in my mouth or in my hand or anything like that. And it's good. It's great, like I said, for fat burning, energy, concentration. I'm very focused and ready to go at all times. You got to be, especially right now, right? So, yeah, so it's really, really good. Sorry, I got cut of the auto. Did you have them mention how much the bags were gym bags? So we don't have any gym bags left. It was just a couple that we had in stock, and we had the picture taken. And that was it. I will be getting other gym bags, and hopefully $20-$25 is what the price point's going to be. Okay, so it'll be really good. Operator O, BPC for elbows. So golf elbow, tennis elbow, right above the forearm. That's tennis elbow. Golf elbow is right here. If you have pains in those areas, and I've had them, and we have a lot of people that do, BPC 157 is great for it. It's helped me in the past dramatically. I did videos on it before. You can find them on YouTube. You can find them on our social media page where I go through and I did the rehabilitation with the BPC, especially with that. Golf elbow, tennis elbow, gone. Now here's a trick and tip that I learned after this, right? Because I'm like, listen, I don't want to have to get this. How can I go about not getting tennis elbow? That was the main one, right? Because I should get that more often. And you really find out it comes from your grip. So the grip actually, it comes up into your forearm. So if you strengthen your grip, it will actually help develop those muscles in there. So that's a good one. Now, to really be preventative around it, get wraps. So wraps will go around your wrist and tighten up the wrist and tighten up your grip. And that's awesome, okay? BPC, Body Protection Compound, BPC. So BPC 157 comes from the gastric juices. That's good for injuries, chronic injuries, acute injuries, shoulder injuries, ligaments, tendons, muscles. It's really a great healing peptide, okay? All right, so you guys got some more therapies out of me than usual, right? All right, so ECA Stack Plus, great therapy, especially with summer coming up, but I use them year-round. You guys will love them, guarantee it, and you guys will want to use them too. So great with every therapy that Titan Medical Center offers as well. Complements every single one. Will give you great energy, will help you shred up, and concentration will be on point. So that's ECA Stack Plus. Different dosages for different people. Not one cookie-cutter dosage for everybody, all right? All right, so let's talk about what's going on out there. July and August. Now, the reason I bring this up is because where our building is down here in Tampa in Channelside, we're in a beautiful location, and right across is the port. So we get to see the big cruise ships. So it was funny because cruises go out from Tampa. And July and August are going to be the start of cruises. I cannot believe this. It's a great thing. Actually, for me, I figure like, hey, listen, if they're going to let these cruises ship go out, then hopefully we're going to be in a better situation in our country, right? So hopefully nothing happens on these cruise ships. But they're going to start back up July and August, and they said that they have demand. They've got a waiting list to get on these. And me personally, I'm just being honest with you, I'm not going to ever take a cruise again. But I would fly somewhere, I think, if they opened up. I mean, I know they're open right now, but like to go international here in maybe a couple months, maybe by July or August, wearing a mask and stuff like that. On the plane because of recirculation air and all that good stuff and everybody nearby, I just want to take all the precautions. So, because I did get my COVID-19 antibody test done through LabCorp, which I'll go over, and it came back negative. What up, Rod? How you doing, man? Austin, how you doing? Thanks for joining. Spanish Cowboy 76, what's going on? So, what do you guys think about these cruise ships? You guys think it's a good idea, bad idea? I mean, either way, they're going to do it. So, we'll have to see how it works out. What up, Christine Leonard? Our Cali family. How you doing? So let's get into the blood work review because we're going to go in depth the blood work review. Now stay tuned because afterwards I'm giving away the Titan Corona Stimulus Package giveaway. Free medical provider visit, free immune boosting therapy for you guys, all right? But let's go over the blood work, man. So listen, I practice what I preach all the time. I live exactly the lifestyle that I'm telling you guys right now, all right? And that's what it is. So I do blood work constantly, and now we can do blood work in the office. So at that point, if you're in the area or you live here, you can come down and get blood work done. We'll draw it right for you guys, not a problem. We can draw a ton of tests. But if you guys aren't in the area, We can send you in for blood testing anywhere in the country. All you have to do is call or text 727-389-3220. So let's start off. So obviously it's our full panel. Now I did add some extra tests, and I'll tell you the tests that I added after we go over them, okay? But the first one in Instagram, you guys can't see what Facebook is. So we basically did a CBC, a complete blood cell count, a CMP, okay? I think that's all that's on this sheet. So CBC to CMP is on this sheet, all right? Facebook, you got it, right? Okay. Lipid panel. So lipid panel's on here, and that's like your cholesterol panel. We also did a full thyroid panel, TSH with T3, T4, a free and total testosterone, IGF-1 levels. What else we got on here? Oh, a PSA, so a prostate blood test. We also did on here a hemoglobin A1C, prolactin, estradiol, vitamin B12, progesterone, and a sex hormone binding globulin. Okay, so those are all the tests that we did. Now, you're going to ask me, hey, listen, what do all these tests mean? That's great and everything. First off, if you ever get blood tests, make sure you get a copy. From us, from your, your primary care, whoever does blood testing for you, get a copy. Get a folder, put all your blood tests in there. Right? The reason you should have this is because you should have a folder on yourself. And this folder will tell you where you are from one point to another in these age and dates. And if anything ever happens to you, like you have to go to the hospital or doctors have questions, you're not thinking back in your mind, oh, I think it was this, I think it was that. You'll have all your records together, and you can bring them a copy or make them a copy, and they can look at those records and they can see a full picture about what's going on or what has happened or maybe where you trended from one point to the other, okay? So let's go through it. Complete blood cell count. So really what we're looking at here is white blood cell count, red blood cell count, hemoglobin, hematocrit, monocytes, neutrophils, all this good stuff, right? The big one on here, especially on mine right now, so white blood cell count, and it came back at a 12.6, which is high. With it being 12.6 like that, the white blood cell count it's there to defend the body, all right? So that's what white blood cells do. They defend the body against infection. So you can have, if this is high, infection could be there, inflammation, allergic responses. It's the body reacting, and it's creating these white blood cells. These white blood cells are going out, and they're trying to fight for your body and what's going on. All right, red blood cell count, hemoglobin, hematocrit. Let's go over those three because they're very important, especially if you're on testosterone or hormone replacement therapy. So we want to look at these numbers. Now, red blood cell count, red blood cells pick up oxygen from the blood and deliver it to tissues throughout the body. Your hemoglobin is oxygen-carrying pigment in the RBCs. Hematocrit is the percentage of red blood cells in the blood. Now, when these all go high, what happens is you create a whole bunch more red blood cells, if these are high, and the hemoglobin and hematocrit actually, because there's so many and all this thickens, it thickens the blood. So your blood can become like sludge, and you can cause a stroke, DVT, blood clots, issues like that. So that's the real big ones you want to look at in a complete blood cell count. Now, you can also look at some of the different ones, like I said, MCH, PLT. I mean, there's a lot of different things like platelet counts and stuff like that you can look at. Not really issues, unless one's really, really off. And we can go through those, but the main ones I want to talk about, because I can sit through here and talk through this blood forever. The next one is glucose, so CMP, Comprehensive Metabolic Panel. Now, what's a comprehensive metabolic panel really going to cover, or what really should you look at on here? So let's talk about it. The first one's glucose. So glucose is your sugar levels. And that's your sugar levels at a fasted rate. It's the sugar in the blood. That's the glucose. So it's telling you at that point in time how much sugar you have in your blood. Your EGFR. All right. Now, when you look at an EGFR, there's two. There's non-African American and there's African American. Kind of crazy because people are people, right? But there's different reference ranges, and what this means is this is your kidney functions. Okay, that's basically what it is. The creatinine, the bun go in correlation with this too as well. So, creatinine is waste product produced by muscle metabolism. So, usually you want to look at this. Now, if these are low or high, make sure you guys are hydrated when you guys are going for your blood test. Make sure you guys are staying hydrated. This could have an issue with this. Working out, that could have another issue as far as ALT and AST2 as well, which is liver functions. So that's another thing you're going to look at in your CMP. You're going to look at sugar levels. You're going to look at kidney levels. You're going to look at your liver levels, your liver function levels, where ALT, AST. Let's go to those. So ALT, AST, and you can see with mine one was bumped, and I have not been taking glutathione because I've been getting like 1 IV a week, but I'm going to get back on my glutathione regimen, especially because I did a follow-up to this that I'll show you in the blood test.
What page are you on right now, John?
I'm sorry, I'm on page 2 of 4.
2 of 4. Okay, gotcha. Is that
There
one?
we go. Yep.
Okay.
So ALT, AST, that's your liver functions. You want to make sure that those are in range. Some of those can be affected by acetaminophen, a lot of drinking. Like I said, if you're working out really hard and stuff like that, you want to give yourself at least a day or two rest. Or if these functions come back high or out of range, retest just to make sure, hey, listen, I got this back. What makes gynoprolactin? Why does that go up? All right, so I'll answer that question in 1 second. All right, so let's talk. I'll answer some of these questions and I'll go on. Dad lives down in Port Charlotte. He liked them before, but I think it's soon now. Seems like a good time, though. Yes, Kenny, definitely. It seems like a good time. Heck no, Jim Rona, no, its members won't be on no cruise ship. Definitely won't be on no cruise ships, me neither. All right. So is it normal for working out and increase your creatinine levels above normal? I had blood work done recently. It was 0.5 above normal. So, Jay, that's probably, if you went to a medical provider, they're probably not going to say anything as far as being concerned about that. That's very minimal as far as an increase. And creatinine could be affected by dehydration, which if you were training beforehand really hard and maybe not getting enough water, that could cause a dehydration. So retest to see where it's at. Make sure you're fully hydrated. What makes gyno? Prolactin? Why does that go up? Okay, so let's talk about that. So gynecomastia is really made by high estrogen levels. And for guys, we want to look at estradiol in particular. Prolactin can have a cause of causing tenderness, lactating. I've seen some guys lactate. It's not cool, but I have seen it, guys. People have done it. But gynecomastia usually comes from high estrogen levels. And why? What is gynecomastia? Gynecomastia is tissue growth, okay? And that's usually because of these high levels. And it creates tissue, and this tissue, it can't be burned off. It has to be surgically removed. That's why people that get gynecomastia, hey, listen, the only way you're getting rid of it is through surgery. No, there's no other ways. At that point, you can do all the fat burning you want, all the exercises, everything like that. Unfortunately, if it's real gynecomastia, it's usually surgery time. Is it safe to take ECA Stack with high blood pressure? So probably not. At that point, the medical providers are probably not going to want somebody that's on now it just depends on the dose of high blood pressure medication. If it's a very small dose or minimal dose, it just really depends. That's why it's customized to patients, right? We want to make sure the regimen is good for the patient. It shouldn't be a cookie cutter regimen. So that's what it is. Yes, Paul, it is. Flick this right. Okay, how you doing? I see. All right, so let's go to the lipid panel. So lipid panel, lipid with LDL and HDL. So lipid panel is, it's your cholesterol. It's what's going on with triglycerides, HDL, which is your good cholesterol, LDL, which is your bad cholesterol, and then it has an HDL to LDL ratio. So that ratio is going to tell you, hey, listen, your good cholesterol, the bad cholesterol is okay. So even if people have really, really good HDLs, and that's your good cholesterol, and some people do and some people don't. Mine was, I don't even know what mine was. So mine was low. So my HDL, my good cholesterol is not even that good right now. And that's why I was like, I need to change up the diet. Because, I do a lot of blood tests every 3 to 6 months. And usually my good cholesterol is very good. My ratio is usually awesome. But on here, as you can see, now one thing that could be affected by this, and the reason I didn't trip out about my numbers being high in all of these, is that when you do a blood test for a lipid panel for your cholesterol like this, what has to happen is you have to fast. You have to fast for at least 12 hours before those tests. The reason, those tests can be skewed just like the glucose level, okay? So you want to make sure you're fasted. So I wasn't really worried about this. I know my cholesterol's been very, very good before this. I think that because I did not fast and then I ate right before this blood was drawn, because I didn't think I was going to get my blood drawn this day, that's why it was like that. Okay? So just look at it, make sure. LDL is low density lipoprotein and HDL is high density lipoprotein. So you guys know that, right? So want to make sure that you're good to go. All right, so TSH. Let's talk about TSH. Thyroid stimulating hormone. Yes, love that thyroid stimulating hormone. Guys, stay tuned. I'm going with this blood work. We're going to give away the free Titan Corona Stack Titan Corona Stimulus Package giveaway, free medical visit, free medical immune system boosting therapy for you guys. All right, so thyroid stimulating hormone, a hormone secreted by the pituitary gland, can tell you if you're hyperthyroidism. It's primary, for a doctor to usually diagnose primary hyperthyroidism. Hypo and hyperthyroidism is out there for you guys. So these are good tests to know these things. So when you look at your thyroid stimulating hormone, usually if it's real low like that, you're really burning through, your metabolism's usually running pretty good, right? If it's usually higher, usually have more of a sluggish, it's hard to really burn through fat or metabolism boosted like that. And correlation with T3 and T4 and free thyroxine index. So all these will correlate. Usually a primary care doctor is really going to look at TSH. Now, if these are off, you might need a thyroid medication. I would not recommend that right off the bat unless you know for sure, because those and thyroid can mess with everything in the body too as well. Hormones are signals and directions, and it tells your body exactly what to do or what not to do. And this causes the health issues, the physical issues, the mental issues possibly. So at that point, you really want to make sure that everything is just optimal and dialed in, okay? No, it's all good, man. I try to give away the information for free. So I appreciate you guys all tuning in. Thank you guys for tuning in for Titan Talk Tuesday. I just wanted to help you guys out. IGF-1, insulin growth factor 1. So this is really cool. And my Z-score here was 319, 3.6. So the Z-score is like your average of where you fall within your age group and everything like that. And the 319 is a score within your reference range. And reference ranges can change on blood tests depending on your age for this. So just look at the particulars. When you're looking, the reference range is to the right over there. So right behind me, like right here, this is the reference range. Yep, that's the reference range. So your number wants to be usually in between there or higher on this. Some things you want to be a little higher, some things you want to be in the middle, but usually want to be within those ranges, okay? And some things you want to be in optimal ranges at the higher end of those things. Some you want to be at lower ranges. So it just all depends. And that's what your practitioner should be able to go over with you. Free and total testosterone ranges. Optimally, obviously, mine was optimal. And I took this right at the peak of my testosterone. That's why it says 1500. And free testosterone is the same thing. So I didn't plan to take this blood test, like I said. So at that point, you do get a spike, possibly, when the ester kicks in. And that's where you're going to see those ranges. PSA, total prostate-specific androgen. So this is going to be the first line of defense blood test-wise to see if you have any issues as far as the prostate enlarging, inflammation in the prostate. And at that point, you can look at it.
Is that the third page, Joe?
Yes, that's 3 or 4. All right. So that's really easy to understand. Hemoglobin A1C. So hemoglobin A1C is awesome. And if you have a glucose level that's always coming back high and you fast, you should definitely do a hemoglobin A1C. Even if you don't, do a hemoglobin A1C once a year at least. And what this really is going to tell you is if you're pre-diabetic, you're diabetic, you need glycemic control, for diabetes, so it's going to tell you where you're at, where you fall. And then, getting on top of this early is key for young kids and for adults. The faster you find out if you are diabetic or need these diabetic medications, the better off you're probably going to be. Because when you have high sugar levels in the blood, what happens is cells start to deteriorate. So at that point, you want to make sure that your hemoglobin A1C, which is a 3-month average of your sugar levels, whether you fast or not. See, that's the best thing about it. So you really know exactly where you stand. Okay. Prolactin, this was an extra one. So hemoglobin A1C, prolactin, these are extra tests. I ran this just to show somebody on prolactin levels kind of where I fall at. I've never really had any issues with prolactin, prolactemia, or anything, and that's like a tumor on the pituitary that could cause these issues of prolactemia or prolactin levels being high. Watch out. There's also some medications that people take that are not prescribed that can happen to raise prolactin levels, and that is usually where you get those guys that are lactating out of their nipples, like cats or like females. Okay, high prolactin levels are definitely that, and usually high prolactin levels go right along with a female that is lactating or breastfeeding. All right, estradiol. So this is one we run for guys. So estradiol, or E2. So this is one thing that we want to go over. All right, so when you take in testosterone, when you do testosterone, whether it's a cream, an injectable, an oral, whatever you're going to do as far as transportation rate, we know this. We know that testosterone is going to aromatize into other things. Aromatize is going to convert. What's it going to convert into? It's going to convert into dihydrotestosterone, which is DHT, or it's going to convert into estrogen or estradiol. So at that point, when estrogen goes high, this is when you start getting negative side effects from testosterone or hormone replacement therapy. What can happen? What are these negative benefits? What should you be looking for? 1, irritability. 2, right? You're very sensitive. You're crying over Frisky commercials, movies, things you wouldn't cry about. You're being very sensitive. You catch yourself at the end like, what the hell is going on here, right? It's going to cause fat deposits. So you're going to have unwanted fat deposits or hold fat on the body that you normally wouldn't. ED, sexual dysfunction. This could cause another thing for guys especially. So at that point, you want to make sure that your estradiol is in check and it's within range. I see people out there that are talking on the internet about ratios. So your testosterone is this ratio, so your estradiol can be this high in this ratio. Guys, I'm telling you, I've seen thousands of blood tests. We have thousands of patients come through, been over 8 years. Every person we've seen, the best results they've ever had is when their estradiol is within range. Now that number, it can differentiate. Some people feel better at 10. Some people feel better at 24. You definitely don't want to be over range in estradiol. And usually, if you are, you'll start getting the negative side effects: bloating, water retention, irritability, being sensitive. And now, what else happens? Those estrogen levels stay high like that. You start getting fat deposits, and then the possible gynecomastia that we talked about earlier happens. So this is one thing that you should check for. Make sure it's within range. Just by itself, if you're not taking hormones, some people are, they're high sensitive as far as converting in their body, males and females, to estrogen. So estradiol is one of them. So make sure you guys are checking that out, and you guys will know. SARS-CoV-2 antibody IgG test. So if you guys aren't seeing that, you guys can see it on here for Instagram. And the IgG test is right here. And of course, I came back negative. Thank God. I don't know if that's a good thing or a bad thing, to be honest with you guys. So there's a lot of tests out there. They were trying to sell a lot of these kits, and I know there's a lot of bunk kits that came over from China that the government's, they're actually cracking down on people for selling right now over the internet and stuff like that. But there's a lot of medical companies that came out kits that were FDA cleared. And at that point, they were trying to sell it to all these medical clinics and stuff like that. They came at us. These are $25 tests, real cheap tests, and they had no validity by the FDA. Though they got cleared, but nobody looked at them from the FDA. So that was a big issue with us. And, for that, we couldn't stand behind it. Plus, we were having these, we had reports come back that half of them were off as far as what the test was. If it was negative, positive, it was a false negative, or if these tests really worked correctly. So when LabCorp and Quest came out with their testing for this was probably the most secure way I've ever seen as far as, they're a real lab. They're testing most of the blood in the country already, and they're pretty much on it as far as that goes for validity. So I came back negative. We can also do this test on any of your guys' blood work if you want to know if you have the antibodies or not. So if you possibly be infected, have been infected, or been exposed to COVID-19, this can actually show you. So it's really, really cool. For me, like I said, I came back negative. I don't know if that's a good thing or a bad thing because, hey, listen, I never caught coronavirus. That's awesome. But I've never caught coronavirus, so I'm at risk to catch coronavirus. So at that point, that's kind of where it is. Vitamin B12 on there. You guys will see that. It's through the roof. I take my injections almost every day. That's why. So it's going to be high on my vitamin B12. Don't freak out if your vitamin B12 is high and you're taking supplementation that makes it high. We know why it's high. If it was high without you doing that, that might be an issue, but you're good there. Progesterone, that's another hormone, affects males and females. And all these hormones affect males and females that we're going over. So progesterone's, sleep, anxiety, hair, like a lot of different things progesterone goes along with, okay? Sexual hormone binding globulin. So SHBG, this is a big one right here. So SHBG, what's up, Deke? My man, we got to get up, Deke. What's the best place to shoot the vitamin B12? I'll get to your question in 1 second, Milo, okay? So SHBG. So SHBG, I wanted to show on here because sometimes SHBG can be high. Now, usually when SHBG is high, the reason I did this was because free testosterone is usually binded up, right? It's getting binded, and the SHBG is very, very high because it's binding all this testosterone up, and it's not utilized for your body. Where this, at that point, mine is very low. It's low. My body's utilizing pretty much all the testosterone it possibly can get in its body, which is a good thing. But some people, they automatically have a high SHBG, and a high SHBG can cause ED, a lot of dysfunction. But that could correlate right along with free testosterone levels being low because of your total could be awesome, your reservoir total is great, but free is low. So the reason is you're having these symptoms because your body is not utilizing, it's not taking and freeing up the testosterone that it has in its body. So that's really where it's at, okay? Where is the best place to shoot B12? So B12, I usually shoot IM with a little insulin needle like this big, and I usually shoot it right in the deltoid. Okay, that's usually the best place. You can shoot it in your glutes, your butt. I mean, you can shoot it in any muscle you really want to. B12 really doesn't hurt that bad. It's water soluble. It shouldn't have any pain. And it'll be effective anywhere you shoot it, okay? Even some people shoot it subcutaneous. I wouldn't do it, but hey, listen, you can do that too as well, okay? So how much more intricate is the panel than normal? How do we ask for it? All right, so Kenny, so this is a pretty full panel from us as far as when we say, hey, listen, the full panel. And we got a special right now. Guys, 130, girls 200. You'll get everything in this panel except for SHBG, prolactin, hemoglobin A1C, and COVID-19 test. So the COVID-19 antibody test is $150. All those other tests up there are $25 and $30 if you want to add on to the $130 price. So if you want to add on all four, like the prolactin, SHBG, hemoglobin A1C, was there another one on there? I think that was it. It's like another $75 if you want to do that like that. So it's really great deal. You will not find a better deal on blood work anywhere in the country or in the nation. I guarantee it. And if you do, please show me, and I'll definitely match it or beat the price for you guys. But I'm guaranteeing you won't even do it. Not even if you brought this to LabCorp. So that's what it is. All right. So it's pretty intricate.
Yeah, Big Drew on.
Big Drew, what up? Team Titan all day. My man Drew. Don't forget, guys, Titan Lifestyle Big Drew this Friday. We're going to be tuned in. I want you guys, we have some great topics to cover. What's your opinion on the side effects to benefits ratio of using IGF-1 LR3? So insulin growth factor 1, long-lasting LR3. So honestly, the benefits definitely, there's really no negative side effects per se, unless you have cancer cells in the body. It can expedite growth of cancer cells. I ain't going to lie about that. But usually the benefits usually outweigh the negative effects. But if you have that family history of cancer, or if you had cancer before, think you have cancer, definitely not a good therapy, okay? For people that are generally healthy and stuff like that, IGF-1 levels are on the lower side, not high. Definitely a great therapy. I'm taking IGF-1 LR3 right now. I've taken it for years. We've had it as a therapy for years. It's got a lot of patients, a lot of great results. I got a lot of people that, they rave over the IGF-1 LR3. So it's really a great therapy, way better than growth hormone as far as that goes. Fraction of the price, third of the price. So it's really, the best. All right. Barbie V, what's going on, man? She's been killing. I've been seeing her posts. She's been nuts. So big shout out to her. So all right, we've went over the blood work review. I've went over all my blood work with you guys. Let's talk about one or two more things, and then we're doing the Titan Corona Stimulus Package giveaway. All right, so have you guys seen what Ford was doing? So I know we've heard about these respirators and ventilators and stuff like that, but Ford, man, they came out with these respirators, and I was really impressed by them, and that's why I really want to talk to them. 3M and Ford, man. I mean, they produce these ventilators, and it's like positive, like airflow, and like it's guaranteed, like nothing can come in here. So for medical providers and stuff like that, that are on the front lines of COVID-19 and they really don't want to catch it, I think this is probably the best system I've seen. And they'll probably be using this to go on for a long-lasting time. I would probably think. So big shout out to Ford and all the other companies that have repurposed their businesses to produce items for this pandemic that's going on out there, or the problems that's been going on out there. Hopefully our supply chain comes back to the United States too as well, right? That would be awesome. All right, so let's go over the Titan newsletter poll. All right, so the Titan poll was, have you ever tried doctor-prescribed weight loss medications? So have you ever tried any therapies? Like there's FDA appetite suppressants out there. Obviously there's, I know some of these places, B12, like super mix shots, or, ECAs maybe you tried, or, have you tried any of these doctor-prescribed weight loss medications, especially right now with summer coming up?
Also, we've got the poll on Facebook Live as well.
Oh, cool. All right, so
Facebook, and then we'll do the regular poll from the newsletter.
Yeah, let's do it. So the Facebook poll, the exact same poll question, have you ever tried doctor-prescribed weight loss medications? 36% was a tie. No. Should I? Question mark. Or yes, I've tried the injectables. So we're half and half there, right? 0% said yes, but they didn't work for me. 27% yes, oral therapies. So there are some people out there that have tried these doctor-prescribed therapies. Now, like I said, there's a lot of good ones we have. Titan Complete, Titan Up, ECA Stack Plus, AOD 9604 as far as peptides. So that's good that some people have, and some people, should I? So yeah, I mean, if you're looking to lean up and you're looking to shred some pounds and stuff like that, you want to burn some fat, or you want just some good energy and boosting metabolism, these therapies will be great for that. Who doesn't want to lose a couple inches off the waist?
Yeah, here we go.
It's very rare that I hear some, and there are some people out there like, I need to gain weight. I can't gain weight. I eat everything. I can't gain weight. And they're really, really tiny, right? And that could be because they're thyroid or something else. That could be a hormone too as well. Or they just might have a fast metabolism burning through it. But majority of people, they want to lose some weight, especially the older I think people get. It's hard because metabolism slow down, hormones decline or become deficient, eating habits with people, non-exercise or activity. This goes all along with everything that we're talking about. So let's talk about the newsletter poll. Same question. 45% said no. Should I? Why should I? Wow, 45%. Man, that's a lot of people reading our newsletter that click on this to say that. That's crazy. 0% said yes, but they did not work for me. So that's at least pretty consistent with both polls. And it was a tie for yes injectables and yes oral therapies at 27%. So people have both tried injectables and yes oral therapy. So that's good. So people are trying these different therapies. So that's great. For the people, no, why should I? Maybe you guys want to lose some weight, or you guys want to tone up, or you guys want that sexy beach body. And this is definitely a way you guys can help get it, okay? So it'll help expedite those great things that you're doing with exercise and with a nutrition plan, all right? So I think that ends this week. We have our giveaway that we're going to do, the Corona Titan Stimulus Package giveaway. Free medical provider consultation, free immune boosting therapy. You guys are all able to do this, right? What I'm going to do to make it fair with Facebook and Instagram, because I have both of you guys on here, is we're going to pick the 10th person, and you guys will have to text the line 727-389-3220. So it's our main phone number. You guys are going to text it, and you are going to put hashtag Titan Stimulus. Hashtag Titan Stimulus. Text it to 727-389-3220. Free medical provider consultation, and you'll get the free immune system boosting therapy package. So I hope you guys will take advantage of this. Thank you guys for tuning in. Titan Talk Tuesday. This one was definitely a success. I feel like I shared a lot of knowledge and information with you guys. I hope you guys have liked the information and knowledge I've shared. If you guys do, please, if you're on YouTube, press subscribe, hit all notifications. On Facebook, please press share at the bottom. Tag some people. All right? Instagram, you guys can share this to your story. You guys can also tag people in the comment section now. But To get the Corona Titan Stimulus Package, you guys are going to have to text 727-389-3220, hashtag Titan Stimulus. All right, guys. I'm John from Titan. I appreciate you guys tuning in. Don't forget, Titan Lifestyle with Big Drew this Friday, 2 p.m. Also, our Titan Medical Health and Lifestyle Show, ABC, 11 a.m. every Sunday here in Florida. But now we're going to do it for you guys. If you guys are not in the Florida area and you guys want to see this, go to our Facebook page, Titan Medical Center. Click like. Make sure you guys are following it, right? We are going to broadcast that through social media for you guys so you guys can watch it real time with everybody else here in Florida. So I appreciate you guys tuning in once again, guys. I am John from Titan. Thank you guys very much. I hope you guys win the Titan Corona Stimulus Package. I'll see you guys Friday, guys. See ya.